Today I'm going to be speaking to Eve and Ellie about a clinical psychology master's. So Eve and Ellie are both assistant psychologists at Private Therapy Clinic. Hi Eve, how are you doing today?
Hi Adam, I'm great, thank you. How are you?
Good, thanks.
So hi Ellie, thank you so much for joining us today. And thank you so much for agreeing to share your experience of studying a clinical psychology master's.
Hi guys, thanks for having me.
So I just kind of want to go back to basics and ask you what kind of prompted you to study clinical psychology at a master's level?
Of course. So throughout my undergraduate degree, I didn't kind of know what I wanted to do until I sort of found my feet in the third year. I did want to go down the clinical route and find out a bit more about the clinical applications of psychology. So I did my undergraduate degree at Newcastle, and then I just decided I was going to carry on and do the clinical master's degree also at Newcastle. I think a lot of people will find that with clinical, there's a lot of Chinese whispers or rumours, or it's impossible to get on. So for me, it was just to find out a bit more. My undergraduate degree was very much about the breadth of psychology, and there wasn't much going in on the clinical side. So that's really why I wanted to do the master's, to find out a bit more. And also, my undergraduate dissertation wasn't very clinical, so I thought doing the master's degree and getting that extra research experience would be really helpful, and working with the clinical population particularly would be helpful for moving forward for clinical doctorate training.
Okay, thanks Ellie. Yeah. So I guess you kind of said that the clinical master's allows you to really focus in on something specific in clinical psychology, and instead of being so varied, it's more specific. Would you mind just giving us like a quick overview on the whole degree and just what it kind of entailed?
Of course. So the degree was, unlike an undergraduate degree, it's a whole year. So it's September through to September, and it's split into three different semesters. And it really focuses on the practical side of clinical psychology. So it sounds quite silly, but like, what is a clinical psychologist? What are the key skills and sort of the therapeutic modalities that you'll be working with? So the first semester is your core modules. You have to take them, and it's advanced research methods. So learning more about sophisticated statistical analysis, building upon your undergraduate, but there was quite a big step up, particularly with sort of working autonomously. And that was something that is quite difficult. And a lot of the students struggled with not being told exactly what to do and sort of figuring it out and finding your feet. And then we also did cultural and historical factors of clinical psychology, which was really interesting to go through sort of how mental health presents in different cultures and the history of clinical psychology. And how different disorders might have developed and our understanding developed. So that was quite an interesting module. And then the third module we took was professional issues. So that was, we had guest lecturers each week to talk about different factors of clinical psychology. One week we worked with pharmacy students, so we really got that experience working in a multidisciplinary team, sort of like a mini one, but getting that initial experience. We had someone coming in to talk about diversity and inclusion in clinical psychology, which is a massive issue with the discipline as a whole. So it was a really sort of practical side of clinical psychology and developing reflective practitioners. So I think one of the strangest things for me was the professional issues module I was talking about was I had to write a reflective report. So being told that I can talk about myself in my writing, as opposed to like academic writing, which is, you know, stick to the facts, stick to your references. So they asked about my feelings, and it was really bizarre to talk about that in sort of an academic piece of writing. And then you get your optional modules in the second semester. So that was where I took CBT module. We got to do role plays, learn about CBT, different models for different common disorders. So all the anxiety disorders in quite a lot of depth. And then I also took a research apprenticeship. So that was where I got to work under the supervision of an established researcher, gaining quite good research experience, but again, working independently towards sort of a shared aim with them. And then I did a legal module. So I got to go to court, sit in on sort of three court cases, and then write my reflections and how it could apply to clinical psychology. A lot of reflective practice, as you can see. And then the final semester was the dissertation, so your research project.
That sounds really cool, especially because I don't know about you guys and how you found your kind of undergraduate studies, but mine doesn't have kind of any practical element at all. So a lot of the time, you can get a bit lost in the theory, and kind of, even though you can be really motivated to kind of get into the applied side of psychology, you kind of forget how all this stuff you're learning in the classroom actually applies to the real world. So that's really cool that you're getting the more kind of applied side of things. So you mentioned CBT, which is obviously such a prevalent method in the field. Did you, I mean, from my experience of learning it at kind of in the university setting, it's been very much touched upon. It's nothing in depth at all. What kind of did you get from that experience, and what kind of extent did you learn about it in?
No, definitely. And I completely agree. The gap between theory and practice is huge. And it's something you only learn about when you're thrown into the practice side of things and you're thinking, I've got all this theory, but like there's such a massive gap. So yeah, on the CBT front, it was quite an in-depth module. My supervisor was the same for my dissertation, so he took the CBT module, so I got to get to know him quite well. And we basically went through CBT as a whole, going through the different waves all the way to third wave CBT models, and then we focused on disorder specific CBT for the following weeks. And then the assignment was an in-depth case study, so we got to pick a disorder that we were interested in. So I picked OCD, and then we were given the opportunity to sort of add information to the case study and really make the case study come alive, and tailor it to what we were looking at. So I specifically was looking at how your family members or your partner can accommodate your symptoms and actually make them worse when they think they're making them better. So that's what I focused my case study on. But we got the experience of sort of learning about disorders, and then the practical side of formulating and then developing treatment plans, all in quite an in-depth case study. And then within the same module, we also got to watch sort of a couple of role plays. So if you were brave enough, you volunteered, and watched the supervisor sort of implement techniques like Socratic questioning and things like that. So getting that visual experience, kind of like you were saying, Eve, broke the gap between theory and practice because you get to watch it play out in front of you.
Yeah, that's actually really, really useful actually, in terms of how much practical experience that you've had in that master's, which is only a year, but it sounds like you got to cover so much, especially like going into court. That's really cool. I really like that. Like you get to sit in on cases and reflect on basically what you observed. But so in terms of like, if we're going to link it to mental illness and mental health, were you ever, so I know you mentioned that you had like case studies and role plays. Is that like the extent of the exposure to a therapy setting that you'll get in a clinical master's, or is there anything more than that?
No, definitely. It's more sort of theoretical based, but then with the practical skills element. So something I mentioned was working with the pharmacy students, so to develop a mini multidisciplinary team. So it was over a couple of weeks, and what we did is we got given some information about a case, and then we had to go to the medical school the week after, and we got to use sort of mock consultation rooms. And in groups, you had to have one representative from psychology, one representative from pharmacy, and carry out a risk assessment with an actor. So I thought I'd be brave and volunteer myself. It was absolutely terrifying, having all my peers behind me watching me, thinking I have no idea what to say, but just trying to draw on sort of any experience I had. And we did get training in basic therapy skills, empathy, things like that. We were never client facing, we were never patient facing, anything like that, just sort of really sort of theory behind the scenes and how we could develop those skills. So I carried out the risk assessment, and a clinical psychologist observed and gave me feedback, which was just invaluable, to get that feedback from them, to know you're saying all the right things, you're showing your empathy. But he could tell that I was really like trying to find the right words. And the best thing I learned was there's no sort of right words, there's no right way to say anything. It's build that relationship, build that rapport. Just even from an hour exercise, it was really great. And then I got to watch one of my peers go ahead, and I was like, that's exactly sort of what I could have been doing. So yeah, not so much in a therapy setting, but developing the skills that you could then go, or just to draw upon more the practical side of it, rather than sort of implementing it as such.
Do you feel like it's prepared you like quite well? Because it sounds like quite a great preparation phase for going then into therapy instead of kind of being thrown in the deep end straight away.
No, definitely. It's definitely prepared me. And like I was saying, just knowing that it's okay that you don't know the right thing to say, just keep the conversation going. It's more important to develop that therapeutic relationship than it is to ask the perfect question. Or they were like, you'll get there in the end. You just need to make sure you're being empathetic. So I definitely think it has prepared me. Something we fed back to the course was we need more of that. Like I said, it was just that sort of couple of weeks that we actually did that. but it was really helpful. And especially working with the pharmacy students, that multidisciplinary team experience, only on a small scale, but knowing that I can't use psychological jargon when talking to them because they have no idea what I'm talking about. Equally, I have no idea what they're talking about when they're talking about all these different drugs, the side effects. It was really interesting to work with them and how we could complement each other and get a holistic care plan together. So yeah, that was a really great experience, just on a really small scale, but it definitely did sort of prepare me moving forward.
That sounds like such a great experience. I'm quite jealous, actually. It sounds like such good preparation for any kind of like clinical or counselling doctorate. So I guess obviously, you know, clinical psychologists are kind of the role of two halves. Like obviously there's the applied side, and then you're also meant to kind of contribute to the field and kind of add new knowledge to the field of psychology. What kind of was the research element like of the masters that you studied?
So like I said, I did a research apprenticeship and I also did my dissertation. So the research apprenticeship optional module that I took, really interesting, got to work with a really great supervisor. And originally we were looking at, he's more on the forensic side of things. So looking at helping him with an international conference. However, COVID kind of interfered a little bit. So I had to completely change my research apprenticeship. And then I was working with him to develop a workshop for individuals working with refugee populations and how we can better capture their testimony, because they experience war crimes all the time, horrible things, but it never gets any further. There's no aftercare, there's nothing else. Perhaps it's not important at that time, they're focusing on their safety, but developing sort of a workshop for moving forward in refugee camps and how there could be someone there that could take that sort of lead in getting that information. So that was one side, and really I learned from that was basically flexibility, things change all the time, and using sort of literature searching strategies and I had to present quite a lot to my supervisor, and then he presented it to his supervisor. So it was all quite a nice way of collating information and skills that way. And then with my dissertation, I worked with one of the doctorate students on a project looking at adult separation anxiety. So what she's realised is there isn't really a good assessment measure for adult separation anxiety or screening tool. It was only recently introduced in the most recent manual of the DSM, so it's quite new and there's not a lot of research behind it. So what she's done is she's operationalised the diagnostic criteria into an assessment tool. And then my project was to look at the psychometric value of this scale and look at sensitivity and specificity. So how well does it pick up adult separation anxiety, and how well does it differentiate between that and GAD, because there's a massive overlap between the two of them. So that was really my research project. So yeah, I got sort of two research experiences, very different, but very valuable.
Yeah, that actually sounded like really, really relevant as well. I know that like most research projects, you're kind of just trying to find something to do and end up picking something that it's not very relevant at all. But no, yeah, it's contributing to the DSM sounds amazing. In terms of, I guess, career opportunities after completing a clinical psychology master's, like what would you kind of expect after you get that qualification? Like what are the next steps and what are the options that are available to you, if you wouldn't mind just speaking about that?
Helpful for sort of now hitting desirable criteria rather than essential. So having the masters, you have that extra bit of research experience, not so much on the clinical side, but like the research and the application, and things like being a reflective practitioner and having practice doing that can be really helpful in interviews, but also, like I say, hitting that desirable criteria moving forward. So it's not a prerequisite for a doctorate course at all. It can just help, it can just give you that little bit of extra, specifically on the research side of things. Because like you say, the doctorates are split, clinical and research. Having a master's just adds to that. Also, it helps with sort of career opportunities in research assistants. So I know a couple of my friends have gone on to do that. So having the master's really was the groundwork for them getting that position, because they have that extra level of research experience. And like I said, it was quite independent, completely out of the comfort zone, but it's good to get that practice. And I think that was something that they said moving forward was really helpful, having the opportunity to be a research assistant now, because they've got that extra level.
Yeah, I think that's the thing. Like, it's so competitive. It's such a competitive field that we're all trying to kind of progress in. So anything that you can have that kind of opens your eyes to it and gives you that experience, and obviously, as you say, like reflective practice is so important. It's just so helpful. Out of interest, what did you kind of find the most challenging aspect of it?
I think aside from COVID interfering, I think the most challenging thing was the level of autonomy you get over your assignments. With undergrad, you're told, okay, write an essay on this, use this, include this model. This was just write an essay on whatever you're interested in, which is great to have that level of sort of independence over your work and know that what your thoughts and your feelings and your evaluation has value. It's quite daunting though when you know it's being marked. So you want to know what they want to see, but what they want to see is independent thought. So getting your head around that was quite difficult. I think particularly with advanced research methods, it was a big step up. And then to be told not a lot of information about what they want us to do. Luckily, my the supervisor was amazing, and we just all sat in his room like, please help us. We have no idea what we're doing. It's the first assignment. So yeah, I think that level of independent work was something that was quite difficult. And again, the impact of COVID was quite came at quite a bad time, obviously for everyone, but particularly for the MSc, because it was right as dissertations were about to start. I didn't get to meet my supervisor. Data collection was delayed. It just was sort of that uncertainty behind it did make it a little bit more challenging. But we got extensions, and there was sort of exceptions made for students who really did feel the impact slightly more than others. So yeah, I think the two things I would say is the level of independent thought and work that you have to do, and also unfortunately the impact of COVID.
Thanks so much for sharing that, Ellie. It is something that I think most people who are interested in psychology like think about the kind of masters that you can go into. So it's really useful to hear that and kind of clarify some things that I wasn't sure about as well, like the practical side. That's I didn't know there was that much. I thought it was basically 100% research. But yeah, it's really useful to know that there is that practical element, and it prepares you. And it's not just research based, but it's like a good way to kind of get into the doctorate, and that prepares you for both sides. So thank you so much, Ellie.
Yeah, thank you so much. I think you've definitely sold it to anyone who's been, on the fence about doing one. Yeah, it sounds like such a great experience.
No, definitely. I can't recommend it more highly. And like I said, I did mine at Newcastle. They might be different everywhere else, but that was my experience at Newcastle. And I really do think it just prepared me moving forward.